to defeat coronavirus. Our step-by-step action plan is aiming low the spread of the virus so fewer people need hospital treatment at any one time, protecting the NHS ability to cope. At each point, we have been following scientific and medical advice, and we have been deliberate in our actions, taking the right steps at the right time. We are also taking unprecedented action to increase NHS capacity by dramatically expanding the number of beds, key staff, and life-saving equipment on the front line to give people the care they need when they need it most. This is why we are instructing people to stay at home so we can protect our NHS and save lives. I can report that through the government's ongoing monitoring and testing programme, as of today, a total of 438,991 people in the UK have now been tested for coronavirus. That includes 21,328 tests carried out yesterday. Of those, 108,000 of 5,599 cases since yesterday. 18,978 people are currently in hospital with coronavirus in the UK. And sadly, of those hospitalised with the virus, 14,576 have now died. That is an increase of 847 fatalities since yesterday. Importantly, we need to be confident that any adjustments to the current measures will not risk a second peak of infections that overwhelm the NHS. The worst thing we could do now is ease up too soon and allow a second peak of the virus to hit the NHS and hit the British people. So I want to thank each and every person across the UK who is following and supporting the government's advice to stay at home so that we protect our NHS and ultimately save lives. I know we are asking you to make sacrifices, and it is together we will defeat this invisible enemy. But now is not time to let up. The risk still persists, not only for yourself, but for the people around you. So we must stay vigilant. But of course, the point we hope to get to, one of the ways that we can defeat this virus, is to find a vaccine. Just as Edward Jenner developed the smallpox vaccine in the 18th century, we need to apply the best of British scientific endeavour to the search for the coronavirus vaccine. To that end, I can announce today that the government has set up a vaccines task force to coordinate the efforts of government, academia and industry towards a single goal: to accelerate the development of a coronavirus vaccine. This task force is up, running, and aims to ensure that a vaccine is made available to the public as quickly as possible. The task force reporting to me and Secretary is led by Sir Patrick and Professor Jonathan Van Tam. It comprises representatives from government, industry, academia and regulators. Members include Government Life Sciences champion Sir John Bell, AstraZeneca and the Wellcome Trust. The task force will support progress across all stages of vaccine development and at pace. It will back Britain's most promising research, positioning the UK as a leader in clinical vaccine testing and manufacturing. The task force will coordinate with regulators to facilitate trials which are both rapid and well supervised. And it will work in the UK and internationally, so we're in a position to manufacture vaccines at scale. This will build on the Prime Minister's announcement last month of a further £210 million for CEPI, the international fund to find a vaccine. That the government has green-lighted a further 21 research projects to help fight coronavirus. In total, these projects will receive 14 from the £25 million government research investment and include backing the development of a vaccine at Imperial College London. This for 6 projects announced last month, including vaccine development led by Professor Sarah Gilbert at the University of Oxford Jenner Institute. This is already carrying out preclinical trials and, with government support, will shortly move to a clinical trial phase. So when we do make a breakthrough, we are ready to manufacture by the millions. One tool in this fight will be the UK's first Vaccines Manufacturing Innovation Centre based in Hull, a project that will help build our capacity to develop and mass produce vaccines here in the UK. The government will be accelerating the building of this facility. The Bioindustry Association is also working closely with our task force and bringing together a whole range of businesses keen to use their expertise to mass produce vaccines as soon as. I want to pay heartfelt tribute to all the scientists and researchers working tirelessly on these projects. Yet even with all their efforts, we should be under no illusions. Producing a vaccine is a colossal undertaking, a complex process which will take many months. There are no guarantees, but the government is backing our science, betting big to maximise the chance of success. And I'm proud of how again and again Britain has stepped up and answered the call to action. An enormous challenge being tackled through a vast national effort, where problem solvers from science, business and government join forces to beat this invisible killer. We cannot put a date on when we will get a vaccine, but we live in a country with a rich history of pioneering science, and with the government backing our scientists' chance to do this as quickly as possible. Bond, could I ask you to look at... Yeah, indeed.
Can I have the first slide, please? So you've seen this before. This is the slide of transport use. You can see the dip in transport and using all vehicles over Easter that's come back. We remain very well placed in terms of the efforts that everyone has made to try and reduce their costs. There is one point that I just want to make here, though, which is when we look right the way across the country, there is a little bit of unevenness, particularly in some areas where there haven't been many cases of the disease yet. And I would just urge everybody in every area to really apply the social measures that are in place. And don't think just because you haven't seen it near where you are, it may not be there. It's very important we all do it. Please. This shows the cases, and as I've said repeatedly, this doesn't clearly show all the cases. It shows the cases that have been tested. The blue bars are the ones of patients in hospital. You'd expect this to bump up and down a bit depending on the number of tests done. And you can see this has become flat last few days, and we would expect this to start decreasing in terms of total number of cases. The orange bars show the number of critical care workers that have been tested, and you'd expect as the number of tests go up that this orange bar will go up a little bit over time. The next slide, please, is the most important, that really shows what's happening in terms of number of patients in hospital beds. And here you can see a increase in London, a flattening in most other areas, some decreases in some other areas as well. This is that some of the work that's already underway, not in vaccines, in treatments, is really beginning to take hold. I heard this afternoon that the studies that are underway in the UK have now enrolled over 5,000 people in clinical trials, trying to work out whether medicines that we've already got can work, have some effect. We should start to get answers from these studies over the next weeks. So the numbers are not only at a plateau, but beginning to come down, and that will translate into fewer people in intensive care in due course. But do not expect this to be quick. This is not going to be a sudden drop. There will be a plateau. It will take a while for the numbers to come right down. And that's why it's important that we continue with the strongs that we have in place and continue to do so for the next 3 weeks, and need to do so right the way across the country. Last slide, please. Unfortunately, as the Secretary of State has said, deaths continue to occur from this disease, 847 in the last 24 hours. This is obviously a tragedy. I expect, unfortunately, this number to continue at a plateau for a little while and then to start come down slowly after that. So we are not through this yet. We're headed in the right direction, the measures that are being taken are making a difference, and you can begin to see it in the numbers, and we need to stay firm in terms of the actions we're taking. Thank you.
Great. Patrick, thank you very much for that. The questions. The first question is from the BBC, Fergus Walsh. Fergus.
Thank you. 21,000 tests were carried out yesterday. How are you going to get to 100,000 tests by the end of the month with just 13 days to go?
Thank you very much for that, Fergus. So the capacity currently is 38,000 tests per day, and you will have seen for the announcement from the Health Secretary in terms of testing for key workers as a result of the capacity that is in place. We are continuing to work to make sure that we get to that 100,000 tests a day by the end of the month. We've now got 26 testing centres in terms of drive-through testing centres. 2 of the 3 super are then processing the swabs are up and running. The third one will be coming online shortly. And of course, GSK and AstraZeneca are also setting one up. We are doing everything we can to make sure that we have the capacity available and making sure that we reach that target by the end of this month. I don't know whether, Yvonne, you wanted to add something on this.
Thank you, Secretary of State. So this has been very closely tracked, Fergus, on track. We have more capacity than is being used. And I think the important thing here is that those now in social care and other key workers use this capacity. We are confident that it is there for them. It's very important, particularly in social care, that they do accept the testing. And getting it acceptable locally is the next key.
Great, thank you. Did you want to just come back, Fergus?
Question probably for Sir Patrick. When we do have a vaccine, how will you prioritise who gets it first?
Well, first of all, I think we've got to get a vaccine. It isn't 2 days away, it's not 2 months away.
It's 22 hours.
Making a vaccine is a difficult, complicated process. It doesn't only have to work, it has to be safe. And of course, for a disease like this, it has to be very safe if you're going to use it right the way across the population. So there's a lot to do before we're in that position. And I think industry is looking at really big manufacturing capacity. I think it's going to be important that we vaccinate in the way that you normally do for these diseases, which is to make sure that the most vulnerable are protected and then to roll out to wider vaccination. But that's some way off.
Great. I think the next question is from ITV Anglia, Emma Hutchinson. Emma.
Yes, thank you. First of all, to the Secretary of State, can I ask about the tourism industry? The Transport Secretary said he wouldn't be booking a summer holiday. In the east of England, the tourism industry is worth £7.5 billion. Can you offer any hope to that industry some kind of summer season this year? And then to Sir Patrick, the Norfolk and Norwich Hospital has opened a new surge capacity today, 178. Are you still expecting a further surge of cases in the east of England?
Emma, thank you very much for that question. Look, the first thing I want to say is that I speak to businesses and business representative organisations every day, and I know how tough it is for a lot of businesses. That is why we have put in place measures that we have in terms of supporting businesses, and particularly in terms of hospitality and leisure and retail. As you know, those businesses have a holiday for a year. And in fact, for smaller businesses within those sectors, they're going to get a grant, and many of them have started to receive a grant of £25,000 as well. Additionally, you will have seen today that the Chancellor has extended the furlough scheme to the end of June, which will again help businesses. But I completely acknowledge that this is a very tough time for very many businesses. The key thing we wanted to do throughout this whole process is to make sure we provide that support. So when we come out the other side, we will come out the other side of this, those businesses are able to bounce back because the employees are still in place.
As I've said, I expect the numbers of cases to be coming down. I think the R value is below 1. It takes a while to feed through. Most of the hospitals are beginning to show some plateau of the cases now, and you'd expect the same to go through into intensive care unit. I think the NHS has been hard to make sure they've got the extra capacity, and we said at the beginning this is a mixture of how much demand there's going to be, which I think has now hopefully been measures that are taken, and how much supply there is, and the NHS has been concentrating on building up that supply. So I think we are much more confident that the NHS is going to have its capacity breached during this period. And
Emma, did you want to come back on anything?
Follow up up on when businesses might get back to normal? I know you've spoken about the vaccine today, or plans for a vaccine. Nadine Dorries said this week that the only way we can exit full lockdown is with a vaccine. Is that the case?
Well, what is certainly the case is that we are taking scientific advice from SAGE, and it's very important that we have done that throughout this process. And as a result of that, you would have heard yesterday the Foreign Secretary saying that we're extending for at least 3 weeks the current measures. Everyone watching this at home will understand why we're doing that. And I want to thank the British public, people across the UK who have responded as that this is about protecting the NHS, and ultimately it is about saving their lives. We have put in place, as I said, a whole set of measures to support business, and we want to make sure that they are able to access. So in terms of the grants, we've made sure that £12.3 billion is now with local authorities. The latest stats, and I had a conversation with a whole range of local authorities yesterday, £7 billion has been paid out to small businesses, so almost 300,000 have benefited from that, but we need to make sure we accelerate that and continue to get that support to them. As I said, ultimately this is about making sure that we're safe, always be led by the scientific advice. Thank you. Emma, could I go to Sky and Thomas Moore? Thomas.
Thank you. Oxford scientists behind vaccine trials starting next week have said today that they are so confident that it will work that they will manufacture 1 million dose. Trials are still underway. They hope those will be ready for September. So, Secretary of State, what is the government doing to secure that supply and then make sure that Britain is at the front of the queue for the supply of that vaccine or any other to protect the tens of millions of people in the UK? And how do you balance the rapid development of a vaccine to save lives?
For that, and we are looking to see how we can continue to support vaccine development. And you're absolutely right. The element of this is, of course, also manufacture. That is why we have announced bringing forward the vaccine centre, but also working with the bio-industry as well. So if I can put it like this, is that we are supportive of work that is going on at Oxford, at the General Institute, but also Imperial, and ultimately we are stepping forward as required to support those efforts. But I completely get that this is not just about getting a vaccine, it's also making sure that we manufactured it in some scale.
So I think they've done a great job to get to where they are, and great kudos to the researchers involved at both Oxford and in the Imperial Group and others as well. There are something like over 100 vaccine projects. At least 3 are in the clinic, we think. We know of 2 for certain. I think 3 are as well. Third is as well. We'll see more going into the clinic. Now, just to put some, again, realism on vaccine development, each single project does not have a high probability of success. So although everyone goes out with great enthusiasm and we hope they work, it's never the case that you know you've got a vaccine that's going to work. So that's the first thing that we need to be sure of. This is then the safety. And it's incredibly important that these vaccines are tested properly. That's why it takes some time to get to the clinical trials and understand the potential effects of a vaccine. And then only when that has been done can this be used widely across the population. And so those are the stages we need to go through.
Great. Thomas, did you want to come back on anything?
If I may, yes. Britain is perceived to have been late on tests and late on ventilators. We can't surely afford to be late on vaccines as well. That would not be reassuring for the British population.
Well, just to focus on vaccines, the point of setting up this task force is so that there is full focus on vaccine development, but also in terms of therapeutic treatments as well. If you look at the 27 projects that we are backing, some are vaccines, some are therapeutic treatments. What I would say to you is that as well as the work that we are doing in the UK and the projects we're supporting in the UK, put £250 million into CEPI, which is the international body that is looking at this. And indeed, the CEO of CEPI is a member of that. So this is a international global effort. And as Sir Patrick has said, there are over 100 of these projects that are online. And I hope that they will deliver success and that we will get a vaccine as soon as possible.
And I think we should just be clear, the vaccine could come from anywhere. Yeah. You know, we've got a domestic vaccine discovery program in the UK which is being supported and absolutely as fast as we can go. But the vaccine could come from anywhere. GSK and Sanofi have announced they're doing it, which is fantastic news. Most of the big companies are doing vaccines. This is going to come from somewhere. We just need to back lots of horses at the moment and to make position to access a vaccine when it occurs. And that's why organisations like CEPI are so important as well, to make sure that the world sees this as a way to get a vaccine. And we all need to be part of the same approach to trying to get as many vaccines as we can. And we may need more than one vaccine.
Great, thank you very much for that. Now going to Talk Radio, Charlotte Ivers. Charlotte.
Thank you, Secretary of State. Last week, Matt Hancock announced that there would be investigation of NHS workers who have sadly passed away from COVID-19. I'm aware that you won't be able to give me any details on individual cases, but there have been any general findings from those investigations and whether any changes have been made in the workplace as a result.
Well, can I just firstly pay tribute to all our NHS staff and those working in social care settings as well. And of course, every death is
investigate correctly and fully. And that work is underway. There is also work underway, which you may be alluding to, around certain groups, perhaps in both in the workforce, who may be more at risk, and particularly the signal that Black and ethnic minorities may carry a risk that is evident signals. And that work is also underway. So in both cases, it's very important in both that we actually come up with the right answers. There'll be a lot of speculation as to why people die and what may be the factors, but actually some of these factors are quite complex and they are being investigated correctly. We're doing that.
Thank you. Charlotte, did you have a follow-up?
Yes, please. Could I ask if there's a sense of when these results and these preliminary findings might start to be coming back? I know if someone had died in my place of work, I'd be very, very anxious to hear as soon as possible.
Yes, Charlotte. So not all will be workplace deaths. That's the first thing. And then, importantly, to investigate what are the factors that led to death. So certainly, as soon as that is clear, that will be done. I think they'll be investigated and then communicated in the appropriate way at the right time. And I think it's much more important to get this right than to rush it. But it's seen as very important. Both these investigations are very important.
Great, thank you for that. Thank you, Charlotte. I think we turn to the Telegraph, Gordon Rayner. Gordon.
Thank you, Secretary of State. You told the CBI that businesses and employees would have to get used to a new normal and that things won't go back to the way they were even when the lockdown is lifted. What you mean by new normal? And are you saying that some restrictions will have to stay in place until there's a vaccine, which, as Sir Patrick says, is a long way off?
Yeah, so well, let me talk a little bit about in terms of the workplace. We've been very clear that we are asking people to stay and save lives, and very large numbers of our population are doing that. And we've also said in terms of work is that if you're able to work from home, absolutely do that. And employers are supporting people to do that. And I think that's very, very welcome. There are certain work settings, so you may be in the sector or indeed the construction sector, where it is not possible to work from home and you have to go in. And what we have said is that in those circumstances, plan to work. However, it's also incumbent on employers to make sure that they're following the Public Health England guidance in terms of working safely in the workplace. And certainly the conversations that I have had with employers, with employer organisations, I know that is what they're doing, they're adapting, and that's what I mean about where there is a work setting and people and those workplaces are open and people are going to work, we have to adapt the way that we are working, so we do that safe way and keeping employees safe. Do you have a follow-up, Gordon?
Well, I don't quite understand whether what you're saying is that you expect on working from home until there's a vaccine, or whether you're saying that you expect people to go back to work normally, but just to have social distancing.
No, well, let me clarify, and I apologise if I've not been clear on this. Guidance that we put out, which is you must stay at home. It is about protecting the NHS, and ultimately it's about lives of individuals as well. There are certain exceptions to the staying at home. And one of those is where people who are not home and are well and have to go into a work setting can go into work. But what has been very clear right from the start, and all the discussions I've had with individual citizens representative organisations and individual businesses, is to emphasise that people must be following the Public Health England guidance in terms of safe working. And that is, I think, absolutely vital that happens. And I know from my conversations that actually employers are responding very well to that and working together to make sure they keep their employees safe. Thank you very much for that, Gordon. I think we now move to the Daily Mail and Dan Martin. Dan.
Thank you. The government has talked about easing the lockdown in some areas and strengthening it in others. Could you possibly give us more details about where the lockdown could be strengthened, about different sectors or different demographic groups?
Again, I think it's very important at this point not to muddy talking about an end to the current measures. We are very, very clear, and the Foreign Secretary was very clear yesterday, that the current measures will continue for at least 3 weeks. We would require people to follow that, and at the end of that process, we will be guided by the scientific advice. But we've also set out very clearly, and the start, is that there are 5 tests that will have to be met before we can look at easing the current measures. And those 5 tests, again, are based on the advice that we're getting. But Sir Patrick, I don't know whether you wanted to comment on this point.
Well, I think you're absolutely right. The key thing we need to focus on now is maintaining these measures and the numbers right down. That's what we must do. In terms of what happens after that, I think there are a number of options, and you can see what's happening in other countries as to how they're approaching this, as to how you might think about which measures to release first and how to do that across a range of possibilities. Early to be talking about that, I think we need to be concentrating on getting numbers down and making sure that the extraordinary efforts that have been made to get us to where we are, which is now with an R, we think, below 1 in the community, continue to drive that down further and get these numbers down.
Dan, did you want to come back?
Well, can I just ask about face masks? Sadiq Khan was saying today that he'd like to see them compulsory on public transport. Is that something you're considering? And are you confident that there'll be enough masks if you decide to do that?
Well, I might ask Patrick to comment on that, but just to say is that the PHE guidance currently is that masks should be NHS or social care setting. Clearly, there is a review that SAGE is carrying out, and of course, they will make recommendations and we will take those on. So, Patrick, do you want to comment on
We're
that?
looking at it now. I mean, the evidence is quite variable around masks. It's not easy to really get a firm position on some of it, and there aren't very good trials of masks. We're looking at the evidence now. We looked at it this week twice. We're going to look at it again on Tuesday and hope to be able to make advice around whether any changes are needed or not. At the moment, we're entirely in line with the WHO recommendations. The difference between this disease and others is the pre-symptomatic and asymptomatic, which adds an added complexity to thinking about where masks may or may not fit into this. But one, and I think the Chief Medical Officer has been crystal clear about this, it's absolutely crucial that the masks are available in hospitals and in settings which are a high risk of transmission, and that's where the evidence is very strong that they do work.
Great. Dan, thank you very much for that. The next question is from Left Foot Forward, Joshua Mortimer. Joshua.
Thanks, Josiah Mortimer Forward. Thank you, Secretary of State. As you know, care workers and NHS staff are putting their lives on the line each and every day to get us through this crisis. Was it a mistake for your government to brand those people as low-skilled labour? And to the medics, if I may, working in the NHS and the care sector, only have access to the £96 a week statutory sick pay. Many of those workers can't afford to take time off when they have been pressurised to come into work. Do you recognise this as a threat to public health?
Joshua, thank you for that. Look, can I just say we provide support to those who are supporting us, and that's why you've seen the work that has been going on in terms of testing, in terms of making sure that PPE gets to the front line, and we will continue to do that. So to be very clear on this is that the NHS and NHS workers are absolutely vital to us. We support them because they support us, and I'm very grateful for absolutely everything that they do. Yvonne, did you want to comment on this?
Thank you, Secretary of State. So, Josh, the frontline are the health heroes in this, and it's very important that our guidance has always been clear on this. If you're not well, you shouldn't work. I understand what you're saying about people who feel they have to for various economic reasons, but it's really not in their interest. It may delay their recovery, and it may put those around them at risk as well. Therefore, it's very important also that they do get the equipment they need and that they accept testing, particularly if they're feeling unwell. There is now, as we've said, more capacity for testing than is being used, and the frontline are the priority for that. So that is what I would like to see, is that they accept that.
Josh, do you want to come back?
Yeah, Secretary of State, if I may. I mean, you said that you value the work of NHS and care work. You know, many care workers are on the minimum wage. I mean, would you commit today to ensuring that they do have full pay and full sick pay too?
Firstly, can I say just in terms of testing, so we've had 66,000 NHS staff and social care staff and their families who've been through the testing process. When it comes to making sure that support is provided, there's a whole range of support that we've provided to individuals and businesses, particularly in terms of the furlough schemes, in terms of grants. So we will continue to provide that support. And we've also said when it comes to statutory sick pay, of course, we will support smaller businesses as well for a 2-week period. So there is a lot that I think the government has done, but I want to be absolutely clear with you, Josh, is that we very much value they have across our country within the NHS and, of course, in the social care sector as well. And we will continue to do that. Thank you very much for your question, Josh. Could I move to the Express and Star, Peter Madley? Peter?
Thank you, Secretary of State. 2 questions for all of you. To start off with, parts of a disproportionately high number of cases and deaths from COVID-19. Do you know why some areas of the country have been hit worse than others? And secondly, some hospitals have said they're running critically low on PPE supplies. You've promised to boost supplies, but in a meeting this afternoon, West Midlands Mayor Andy Street said, regarding taking place over the last week, what was promised was not delivered. Will our hospitals be better stocked after next week's deliveries?
Yeah, look, as I said, that I completely understand that people will be worried if there are shortages, and I'm aware of the supply issues that are being raised. There is, of course, a global supply issue. Everyone is trying to get, and you'll have seen the Health Secretary announce some days ago a plan that we have in terms of more manufacturing in the UK. And I want to pay tribute to all of those businesses such as Burberry and Ineos and Diageo and others stepping forward to help in that effort. But just in terms of the numbers, the local resilience forums have been supplies, and in the West Midlands, over 2 million items have been delivered by the LRFs in terms of PPE items. But you're right, we need to be on top of it. That is why we're working night and day in terms of making sure we procure more PPE, but then also expand the manufacture here in the UK itself.
Secretary of State, so I was going to answer your question about why certain populations, why certain places have more cases over time. Initially, we saw cases coming from travel, and that has changed now to very widespread this virus, so it has hit the cities. So we would have expected London to be early on in this, and indeed that's what happened, and then the Midlands as well, because of the concentration of populations. But there are other factors that also drive this at this point, because as Sir Patrick has said, community is now beginning to decrease. So we would now look to where care homes are, or indeed whether there are whether there is transmission within the healthcare system itself. And that's something that's being very closely watched every day as to where these hotspots, in a sense, are. I don't think we've seen the end of this particular phase, which is why it's so important that we continue with the advice on people taking this on social, because I would expect to see this in other parts of the country as well. At the Midlands, we would have expected after London because of the population nature there and the density.
Great. Peter, did you want to come back?
Can I just ask you, Secretary of State, a different question? With the damage that coronavirus is going to do to the UK economy, bearing in mind that the Treasury's coffers are being emptied out at the moment and will continue to